Matthew Holt with a THCB Quickbite from the show floor at Health. I'm with Rami Karjian and Pippa Shulman. They are respectively, left to right, the CEO and the Chief Medical Officer. Look at that. Very good. Thank you for your direction there, Pippa. Of Medically Home. So Medically Home is, among other things, a thing that's got a racing car, for strange reasons, in its booth. So Rami, I'll start with you. Why the hell have you got a racing car in your booth?
Well, we wanted to celebrate the way patients win by providing a common chassis that can work across all different kinds of service lines of taking care that used to be done in buildings like hospitals and doing them in patients' homes better and safer and with higher satisfaction using a common chassis, hence the car analogy.
All right, I think I almost get it. So we better start back at the beginning. So back 6-7 years ago, Pippa, you were hanging out in that medical group's name, who keeps on changing its name and now changed its owner in Boston, where you were the Chief Medical Officer. What was it called? It was called Atrius.
Atrius Health. I was running the Innovation Center.
Right, the Innovation Center, right. And you said, hang on, we need to do something better. What is it you're trying to do better?
Atrius Health did not own hospitals and yet took risk on more than half of its patients. They needed to find a better way to deliver care where patients are. And so I wanted to partner with someone who could help us bring home hospital to life. And I met the co-founders of Medically Home. And then I loved it so much, I very quickly joined the company full time.
Well, fantastic. All right, so you originally started, when I first talked to you about this, you said we're going to reduce sort of 10 to 20% of inpatient admission days. We're going to be in the home. We have a bunch of technology set up to do that, which I guess is the racing car analogy. And then 2 years ago, we had a little issue where hospitals had a lot of patients who maybe couldn't come in or didn't go home. What happened?
Well, with COVID, it really accelerated the idea that patients would be safer in their home and would get better care in their home. And so we saw a lot of new partners come in that we're blessed to work with, and they found more ways of treating more patients with more service lines in more geographies, so that now we're operating in 18 different states with 20 different partners providing great care to their patients.
All right, so what actually goes into the home, Pippa? So I'm being admitted to my house for whatever it is, pneumonia, COVID, whatever. What do I get and what do?
You get, in your home walks a in-home clinician, usually a paramedic, and they set up a small suite of technology to create a hospital room presence, but in your space. We don't move your furniture, we don't move your plants. And then each day, directed by your care plan that your physician and your nurse are operating from the command center at a distance, you will get infusions, you might get mobile imaging, you might get therapies, you will get meals. Anything that you would get in a hospital will be delivered to your home in the same or better time frame with better outcomes to the patient. And if you can't deliver the whole hospital, you're not delivering hospital at home.
All right, so some people have said that hospital at home is putting too much burden on the family members and lay caregivers. What's your response to that?
Absolutely not. And I had a long talk with Alex Drain from Archangel about this, because we really say to the caregivers, you should love your family member and you should be with them, but we also want to relieve you. So if we need to bring someone in to help with ADL support, we will do that. We do not rely on family caregivers to provide the medical care like the infusions or the vital signs. All of that is taken care of by the clinical staff, and we want to leave families and caregivers to support their loved ones.
All right. So since the last time we spoke, you guys got a big investment from a couple of well-known names, Kaiser and Kaiser and Mayo. Tell us a little bit about the business, Rami, about how the investment side's going and what the business spin-off has been with those two and others.
Look, by having partners like Kaiser, like Mayo, Baxter, Cardinal, GMR, all saying because this is better care for patients, we want to help Medically Home get to more patients in more parts of the country with more ways of caring for them. It's really helped accelerate us and help take us to the next level in terms of how we can keep pushing this model.
All right, so how much money have you guys raised and how many patients are you caring for and how many systems you work with? Give me some metrics.
Yeah, so our last round, we raised $112 million with most of those investors coming in, all strategic partners. We're now active in 18 different states across the country. There are 14,000 patients that we've treated with the model since the very beginning, and I continue to believe that with our team and our partners, we're only getting started.
And on the data side and the outcome side, Pippa, okay, we talked about saving a hospital cost way back when at the beginning. What's the data showing so far in terms of outcomes and savings?
The data is incredible. So first of all, more than 50% reduction in readmissions across the board. We're seeing, obviously, you don't get hospital-acquired infections in your home. Patients love this. Patient satisfaction is extremely high, but so is provider, nurse, and other staff satisfaction in the model. That is really, really important. We're also seeing outcomes like decreased mortality, which was demonstrated in the literature. We're seeing the same results in our programs. And this is really looking at patients across a spectrum of socioeconomic status as well. And so we can provide, if you look at neighborhood deprivation index, we are seeing patients in the most deprived neighborhoods be able to take advantage of this model, sometimes in greater numbers than you'd expect than the bricks and mortar.
And the big shift is people aren't talking about this being the same care as hospital. There's broad recognition that it's better care than a hospital for patients who can be sicker in the hospital, who have more needs for social supports than they would be otherwise getting in the hospital. And that's a sea change from where we were 2 or 3 years ago.
And what share of hospital admissions could this type of activity, not just you, overall replace?
So we're seeing 10% today
Currently,
being replaced. And we have our customers that are writing their capital expansion plans based on 20 or 30% of care for sick, complex, or high-risk illnesses move into the hospitals in their patients' homes.
And the last question is, do you owe 90% of your success to being on the Health 2.0 stage and making me dress up like a geriatric 10 years ago, or 100% of it?
150%, Matthew.
Don't forget to enclose the check. My share of 120 million anytime. All right. I've been speaking with Pippa Shulman, Rami Karjian from Medical. Thanks a lot, guys. Congrats on all the expansion.
Take care. Have a great show.